Good afternoon, everyone, and welcome to NASM Live. My name is Prentiss, and I am here again with Wendy Batts and Marty Miller, and our producer in the background, Greg, who I so rudely forgot the last time, so I apologize for that. And today we are going to, you learned about the science of what goes into the OPT model. Now we're going to teach you the art of how to build a program using that science. And we're going to start off today with level 1, phase 1, stabilization endurance training. So I will let these two capable experts take it away. Wendy, tell us what we're trying to accomplish during the stabilization level.
Yes, I mean, Prentiss, exactly what you said. I mean, Marty and I have gone through the last few weeks and talked truly about the science behind the program or the OPT model, why, we do put certain people through different phases, why some of the phases are optional, and then how do you know what phase is best for an individual based on the assessment results. So we wanted to do another webinar and actually go through some of the different phases on how would you design a program based on, what you receive from your assessments. And so that's why we're here today. So if we go to the next slide, I want to actually use a real life client of mine. I know I spoke with or about him in previous webinars, and I changed the name, of course, but and if they did, some of the subjective information you want to get, for example, you want to know their name and their age, and then of course their occupation. So in this case that we're going to talk about, Alex is a dentist. Some of his history is that he's played soccer in high school, and he did that for the first 2 years of college. And he stopped playing sports, unfortunately, due to sustaining an ACL injury that did require surgery, and he hasn't really exercised since college, and he wanted to get back into the gym. He does play recreational sports or wants to get back into playing recreational sports. Currently, he has no issues with his knees, but he does complain of lower back pain and neck pain. And this is basically because as a dentist, you want to think about some of the positions that this individual has to be in and stay in for multiple hours throughout his day. He does not take any medication. He has a clean bill of health. He did get a physical about 3 months ago, so that's how we know that. And, we did talk about, obviously, the medication component. Like, was he taking any supplements? Is there anything that I need to know about? And, of course, that came back as a negative. And then his current goals. I mean, he wants to lose 25 pounds. And, again, when you're getting this information from your client, you want to see, is there a specific time frame that they want to lose this amount of weight? Because again, if he said he wanted to lose 25 pounds in a month, that would be something that I wouldn't deem realistic. So luckily, he said he just wants to lose 25 pounds and he wants to do it the safest and easiest way, which could be over time, which was fantastic. But he does have that nagging pain that he wants to get rid of, and he would like to join a soccer league within the next 6 months. So again, the more information you can get up front by just speaking with your client, that's how you start to also build your rapport, which I think is super, super important. So then, Marty, I don't know, before we move on, I mean, is there anything you want to add on the subjective information side?
No, I think it's just you're really trying to use that first session to build rapport and really find out why they came in. Sometimes as you ask questions, you'll find out that maybe it is the weight loss, maybe it's not the weight loss. Just always asking those open-ended questions and being a fabulous listener. And eventually you'll start to really hear what's important to them and then the whys they're there. And then we use that to hold them accountable to their workouts and their training regimen, because we now have the information on why they came in and what their goals are. So in this current situation, if Alex is not doing his homework that we might assign him or not coming in, we can talk about that 25 pounds. We can talk about that nagging pain in a positive way to just show him that, hey, we understand why you came in. Let's hold you accountable and get you to those goals.
Now, Wendy, and all of us are at some point have been healthcare professionals. So that red flag went off to my chiropractor alter ego. So can you talk about the quality character of your client's pain and why you said, yeah, we can, this is something that we can still work with? in a training session.
Well, exactly. I mean, again, that's why this information is so important, because he said it's nagging and he often has this pain, but it does go away. So It's not something that, he's constantly, having to deal with. It's just, when he has a really long day at work, or he's seeing multiple clients, or even had a surgery that he might have had to go into, he is in, compromised positions. Because you have to think about, when you're a dentist, how you've got to move your head around in your body in different positions to get into someone's mouth the right way to do whatever it is that he's doing that particular day with that particular patient.
All right, awesome. So let's continue. Let's talk about his assessment. Now, are we ready for assessment, by the way, Wendy?
Absolutely. I mean, again, we've gotten the information when we're just talking to him, again, digging into family history, digging in, because again, you also want to kind of continue to talk about, are you sure there's no other, surgeries that you had? Because it never fails. Everybody like, oh yeah, when I was 6, I broke my ankle, So again, you want to try to keep digging a little bit. But when you feel like you've got a good foundation, a good starting point subjectively, just by talking and interacting with your client, then you can move into what we call more of the objective assessments, which is now where we're getting the details based on movement and the assessment results. So therefore, this is what we've termed as measurable results, that every 4 to 6 weeks, we want to go back and redo these assessments to make sure that he is moving along nicely before we up his phase of training. So for example, when this client did his overhead squats, again, make sure you always remove your shoes, or have the client remove their shoes, because again, we don't want the shoes to be a factor. And that seems to be, when you look even online of how do you perform an overhead squat, there's multiple pictures and multiple videos where the client is performing this particular squat with their shoes on. And you definitely don't want to do that, because some people wear orthotics, and some people, have shoes that have a heel on it, like the Nike Airs, for example. Sometimes it puts you in a plantar flex position. So you want to take the shoes off, so therefore it's not a factor, and you can truly see what's happening at the foot and ankle complex. So once you have the shoes off, you're going to put them in the 5 kinetic chain checkpoints. So again, toes are pointed forward, the knees are in line with the second and third toe, hips are in neutral, shoulders are back, and head is back. And so you may have to demo exactly what you or how you want them to line up, because if you just tell someone to point their feet forward, they may point them forward even though they're slightly externally rotated. So again, line them up correctly. And then what I would tell you and strongly suggest is you want to demo the squat as well, because some people don't understand the squat pattern, or they say that they know how to squat, and but again, you're not telling them what to do. You're just going to say, okay, now, for example, try to do this, and you can demo it. And when you're talking about how deep to go, just kind of give them a visual of thinking just like you're going to sit in a chair. So it's not, trying to get, butt to the floor. It's literally just go down in a comfortable position, always keeping it pain-free, fully stand up. And then I'm going to have you continue to do that for reps until I tell you to stop. So again, if someone's more active, you may want them to do more than 5 reps per view. What I personally do is I stand in front of the client. So on the anterior view, I have them begin the squats. I mark, what I see on the anterior side, and then I personally keep them squatting. If they're capable of doing that and they don't need a break, I just walk to the side and look at them from a lateral view. And then again, you can peek around on the posterior view to see if there's an asymmetrical shift, or if their feet are really pronating, you get a good view of it there. And then I revisit the anterior side again, just to see, now that they're kind of getting tired, was there something else that I might have seen once I came back around that I didn't notice the first time? So with this particular individual, his overhead squat results, he had bilateral foot external rotation, so both feet turned out. His left knee only caved in. He did have an anterior pelvic tilt, or a slight arch in the low back, and an excessive forward lean, so he was leaning forward. And then his arms fell forward. And again, thinking about what he does with his job, this does not seem unrealistic to me. And this was kind of, if you think about, like again, his positioning, these are pretty common compensations you would see with someone that does that type of, or has that type of profession. So basically, again, that was his results that I got from the overhead squat. So, because his left knee only caved in, he did have slight external foot rotation. I did feel comfortable because, again, he did play sports. He seemed somewhat active, and I wanted to kind of dig a little bit deeper. So I felt it was safe for Alex to go ahead then to perform a single leg squat. And so I put him again into the 5 kinetic chain checkpoints with his shoes off. We put both hands on the hips. And then from there, I had him do 5 single leg squats, again, going to a depth that he was comfortable. But again, for visual, for the client to think about, chair level. And when we did that, both left and right, he had foot turning out and both knees at this time caving in. So the big key here is if you see the results from the overhead squat, it was only his left knee. But now that we did the single leg squat, it was both. So because there were some mixed results there, I'm actually going to use the results from the single leg squat assessment instead of the overhead squat assessment, because that's more probably realistic. And it does, take into consideration, the base of support as well as how he does from one side to the other.
Okay, that's a great overview of what you did with this assessment. Can I throw you a curveball?
Absolutely.
So when we're talking about assessments, and you've done everything as you've outlined it here, when Alex is ready to get back onto the field and play sports, do you ever check him out? Do you have an additional assessments in your toolbox to test him with his shoes on? Because sometimes, shoes, to quote our fictional character Mars Blackman, everyone who's been watching The Last Dance knows who that is. When everything else is working and you're constantly coming in hurt, it's got to be the shoes. So do you ever take a look at that and see how they're moving around in their shoes to see if that drives any of those impairments?
I do, and that's actually a great point. I mean, when I'm doing the single leg and the overhead squat assessments, I do remove the shoes because, again, I want to see what's happening truly at the foot and ankle. Mm-hmm. However, if I was going to do some more dynamic type assessments, such as like the depth jump or even the shark skill test, mm-hmm. or if I was going to, even if they were doing the Davies, I know it's more upper body, but they can have their shoes on for those. I definitely perform those assessments with shoes on. And, another big thing is even if they weren't ready for dynamic assessments, you can look at their shoes, especially if they've been wearing them over a certain amount of time, to see the wear pattern, because you can see, is the inside of the sole worn out, or is it the outside? Is it, mm-hmm. what's happening, towards the toes and everything, because it will really kind of give you some more insight on their gait and then how they actually walk in, when they're in their shoes. So it's a lot of really valuable information, but yes.
Okay. And I have nothing else, so we're ready to see what you did to train this gentleman. So let's go to the template and go through the program.
Well, instead of showing the template, what Marty and I thought we would do is if we go back to the slide that we're on, I mean, just so you can kind of see one last time the assessment results, we're going to actually show you how to build a workout utilizing this information. And we're going to kind of talk you through how we came up with some of the exercise selections that we thought would benefit Alex, especially the first time that he was going to begin a program with us. I'm going to go ahead and have you have your board show up.
Perfect. Okay, excellent.
Okay, so
I'm as right Clinton as neat as possible.
All right, so Marty, why don't you walk through?
I'm sorry, Wendy, I lost you. Walk through.
So yeah, why don't we start with the warm up? Go through the assessment. We said that we're going to utilize the single leg squat results, and we saw we noted bilateral foot external rotation and bilateral knee caving in. So let's start up there at the warm-up part of the template, and let's identify what you're going to do, do self-myofascial rolling on, and then static stretching.
Yep. So it looks like Wendy is back as well. I think you can hear us now, Wendy, right?
I can.
Sure.
And before, Marty, you get started and what Prentiss just said, I mean, when we say that we're taking the single leg squat results, we are not forgetting about his anterior pelvic tilt, his excessive forward lean, as well as the bilateral arms falling forward. So we're just taking the results for the lower body and replacing it with the bilateral foot and the left knee caving in. So Marty, take us through SMR and what you think we should. Why do we do it, and what do you think would be beneficial for Alex? Okay, so while we're getting Marty back, we're going to think about self-myofascial rolling. And, again, you want to think of timing because your clients usually only have 60 minutes to perform, from the time they walk into the door to the sleep. So we want to be very cognitive of timing. And so when you're thinking about self-myofascial rolling, what we're trying to do is inhibit those muscles that we have found based on the overhead results to be overactive. And so that being said, because he did have foot external rotation, stroke of his calves are going to be overactive. And so because it was on both sides, then that would be, an area that we would want to focus on for sure. Again, because his knees, both knees caved in, we want to think about what causes the knees to cave in. So in this, all right, you back? We want to, again, when we think about the foot stretching out, that's why we think about knee lateral gastroc and the knee caving in. One of the main complexes that pull the knee forward would be the adductor complex. So because of it being on both knees, then we would do bilateral adduction of rolling, rolling the adductors bilaterally. And then the last one would be, thinking about what really connects the upper body to the lower body would be the lats. Mm-hmm. And so then we want to think, we don't want to just only pinpoint the lower body, but because of where the lats insert, both in the lower back as well as in the front of the arm, it can actually cause an anterior pelvic tilt if it's overactive and the arms to fall forward, which in this case with Alex had both. So that would be a really beneficial area to roll as well.
So Wendy, I'll catch up. What SMRs did you assign him?
Bilateral calves.
Yep.
Lateral gastroc more specifically, and then the adductor complex, as well as the lats.
Perfect. Okay. Thank you.
Okay, so again, when you're foam or you're foam rolling, you want to hold the tender areas for approximately 30 seconds or until you feel that the pain is reduced. And, again, due to time, we're just going to do approximately 3 because, again, that would be them doing 6 because we're doing them on both sides. So you want to think on a timing standpoint, this could go ahead and already take anywhere from 3 to 4 minutes of just rolling alone. So once the client has rolled, we want to go back and now think about the proper stretches. So Marty, do you want to talk about which stretches would be beneficial for one and why?
Yeah, absolutely. So we're going to do static stretching, as Wendy was saying. So in static stretching, it's very easy to know what to move into that next bucket of static stretching. If you foam rolled it, you should be lengthening it. You've identified it as overactive. So both, again, the calf complex, adductor complex, and lats bilaterally, because that's what you identified as the muscles you need to inhibit. So we'll just drop those right back down into static, and that will be the techniques that we use to get Alex ready for the next section of the workout.
Mm-hmm. Another one you could really consider doing as well would be the hip flexors. Again, as a dentist, you want to think about him being in a seated position for multiple hours of the day. So to Marty's point, again, think about what's in the best interest after you foam roll. If you go into statically stretching muscles, that would be very beneficial. But if there are others that you feel that you could foam roll some and static stretch some, so they don't always have to be the same. Mm-hmm. However, you do get better results oftentimes if you do what you inhibited, if you go right into stretching those as well.
Okay. And is there one hip flexor that you would stress over another on this case, or would you target all of the muscles in that complex? I'm thinking specifically of looking at the compensations of the knees caving in addition to the pelvic tilt. Would you choose the TFL over the rectus, for example?
Yes. I mean, like I personally like the kneeling hip flexor.
Sure.
One, and because the reason being is if I put them in a 90-90, so where they're in, they're on one knee, and they have them go and bend the back foot up so their toe is touching the ground, they're going to get a really good stretch in their quad. And then the second thing is when they go into a posterior pelvic tilt and they draw in and then squeeze the glute on the side of, let's say that their left knee is down, if they squeeze the left glute, then what they're doing too is with that posterior pelvic tilt and the squeeze, they're also going to really get a lot of the psoas in there as well. And if you think about what the psoas does, it actually connects to all the lumbar spine, which we know obviously with an anterior tilt would be in a shortened position. So that's my preference. Marty, I don't have anything to add, or you choose something different. But
no, I would go by the assessment, and the more you go through your functional anatomy, you'll learn these little nuances that Wendy's talking about. We do show some advanced techniques in our corrective exercise, how to identify, with the modified Thomas test, which one is really showing to be overactive. But, Wendy described it perfectly. So, he's going to be in a seated position a lot all day. So definitely, as long as we're addressing something in the hip flexors, you're moving in the right direction. As you get better with your techniques, you might be able to find, another assessment or two that can really differentiate if one or two of the three hip flexors really need to be targeted.
Perfect.
All right. So once we've gone through, that is, basically what we're trying to do again is to inhibit and lengthen the muscles that we found to be overactive based on the compensations that we see. So now we want to kind of flip over to the other side, and what I mean by that is you want to think about what needs to be activated. And so if you look at the OPT template, under activation, we have core and balance. And so for Alex, we want to think, okay, what would be, again, this is his first session, so we don't have to make it too fancy. We really want to start to activate muscles that we found to be overactive. And number one is his glutes, because again, the anterior pelvic tilt, that's a big red flag. And then you can also see too, when you think about some of the other things that were noted, he's in a seated position all day. And so we know that those poor glutes need to be woken up a little bit. So Marty, what do you think would be a good activation exercise for his glutes?
I love starting out with some type of bridging technique. There's a lot of different ways to do it. It depends on the person's ability and what you're finding as you give them. So I'll start simple, so I always have them do some type of glute bridge. And I see, can they control neutral spine? Can they activate their glutes and not get that cramping in their hamstring or low back? And then from there, as they do a couple reps, I can see, well, this is easy for them. I know my progressions, but I'll always start with some level of a glute bridge.
Perfect. I agree with that. So again, in this case, we could just do something simple like a floor glute bridge. And again, when we think about core in phase one, we want little to no joint motion of the spine, because again, we're trying to really target and try to target those little muscles that protect the spine. Also, what we've termed intervertebral stability. That's actually what we're focusing on in this area. So, again, the glutes would be a primary exercise that would be very beneficial for this client. And then another one that I like, and to try to also kind of get him out of just moving in the sagittal plane. Another one that I think would be great would be something like a side plank. And again, instead of holding 30 to 60 seconds, try to do them more as reps. Because oftentimes people don't know how to really draw in, squeeze the glutes, and maintain proper alignment for a long, long period of time. And then they're really using more shoulder and like foot trying to keep themselves in a position that, quote, looks good, even though they're really not activating the correct muscles. So coming up, holding that for anywhere from 3 to 5 seconds, dropping down, and then repeating. And if you think about it, you could do anywhere from, 12 each side, even, you could do 10 each side. So you kind of need to find out what is best for the client, and truly look at their form. So you never want to compromise their form for a number. So you want to think often, what would be great for that individual.
Absolutely.
Okay, so now that we've activated some muscles that we have found to be underactive, then we want to think about going into balance. And again, we have noticed that his foot goes out, his knees cave in, and we really want to try to strengthen the muscles underneath the arch of his foot, and then really work on proper alignment of the newfound length, if you will. So again, we foam rolled in lengthened areas, we've activated other areas, and now we want to retrain the brain on how to maintain proper alignment of the joints. And so for this particular client, what we could do is just something as simple as a single leg balance. And if they are really, really good with that, then you could throw in frontal plane as well as sagittal plane reaches. So if you notice that, when they're going into the frontal plane, that they start caving in, or they can't maintain, or they don't have any stability there, because you need to work on that, you could just do sagittal only. You could do a mix of both, or again, because it's his first session, you could just do a single leg balance and see how they do for time. But if you're going to add the reaches, I would suggest anywhere for about eight repetitions per leg per side.
Perfect.
And then, oh yeah, go ahead.
Wendy, can you highlight why you're just balancing, why there's no movement when we're doing a phase 1 balance exercise?
Sure. Again, you want to think what is the purpose of a phase 1? And again, we're just training muscles to start working together, quote, nicely, if you will. And so we want little to no motion of the stance leg. And again, just to reiterate what we've said before in previous webinars, we don't want, you don't want any motion of that on the stance leg, because we don't worry about actually doing something like a single leg squat until we get to the resistance portion. So here it's really just little to no joint motion of the stance leg. We're really trying to maintain proper joint alignment. And then can they maintain proper positioning within the 5 kinetic chain checkpoints on one leg and maintaining proper balance throughout?
Okay, great.
So once we've done that, then we usually go into some sort of plyo. And again, plyo is optional for clients in phase 1. And the reason being is if we notice that, the client, they just came out of rehab, they've never really moved at a high, and I say high speed, doing some kind of like plyometric exercise, then they may not feel comfortable on the first day of phase 1 doing a plyo. So again, you want to learn a little bit about your client. This particular client is very active and wants to become active again, and he would be a good candidate to go ahead and try to see how does he do in something as simple as a squat jump with a stabilization hold. Because again, in plyo in phase 1, we're focusing on the landing mechanics. And so what we've talked about, in previous webinars, again, is thinking about where you should land on the reactive portion of the foot. And so just to reiterate where that is, it's behind the ball of the foot, but in front of the arch. So if you were to bend your shoe, again, where that really small area is in the bend of your shoe, that's where you want that client to learn how to land. And if you notice that the feet go out or the knees move in, then that's the time in the 3 to 5 second hold to realign yourself into proper positioning, and then you have them repeat it and then realign themselves and repeat it and realign themselves. But if for some reason the client does not feel comfortable leaving the ground, or you personally just want to work on the technique, then you can actually have them get into a squat position like they're going to jump, and they fully come up into triple extension, meaning their feet do not leave the ground, but they're up on their tiptoes, and then you have them own the landing on the way down. And so again, you're holding that 3 to 5 seconds, even without leaving the ground altogether.
Okay, thanks. And I have one question about the jump, and you explained to us very perfectly about how one should land. But what about the setup position? When I get out into gyms, give you a little context. Sometimes I see people when jumping, they're very quad dominant, not loaded to take advantage of their glutes at all. So their glutes are their rear ends are kind of pointing straight down instead of slightly back. So can you talk a little bit more about that setup and the actual jump mechanics except the landing? You already covered the landing, but talk a little bit more about those jump mechanics.
Yeah, Marty, do you want to take this? I feel like I'm just stealing the show here, so go ahead.
No worries. So really what you're describing is where people are kind of knee dominant, where their knees go forward.
Yes.
So when we think about this in a live workshop during this conversation, I have everyone stand up, ask them, okay, stand up, tighten up your quads, keep your legs as straight as possible, and jump to the ceiling. And they can't move. And I'm like, well, I asked you to go up. Where do you want to go? And they're like, well, I want to go down first. So that's why we have to get more into that triple flexion position, because as we go down, we're stretching the glutes and the quads, and they work together to propel. So since I'm here and I can draw such amazing stick figures, I'll erase this here in a second. But what we're looking for is that perfect squat pattern to where there's that little bit of a lean forward, not an excessive forward lean, a lean forward, but it matches the forward shift in the lower leg, tibia, fibula. And now you've put primarily the glute into stretch. You can use that energy now to propel yourself into triple extension. So that's why we go from triple flexion to triple extension. And then as you land, you want to land just like Wendy said on the ball, you're right behind the ball of your foot, but you also want to land in this position because now the muscles are absorbing the energy, not the joints. So you got to make sure people don't land with their legs locked and then drop into this position. They need to land already in that triple flexion position, and then they lower themselves down a few degrees, and then they would propel themselves back up.
All right. Outstanding. So now let's talk about how they're going to get, let's talk about resistance training. What did you pick, and why did you pick it?
Yes, so just to reiterate, the warm-up itself is the foam rolling, the stretching, and then I say the extended warm-up is the core balance and reactive, because we should have prepared the body now for the resistance portion of this particular phase. So once they've done anywhere from 2 to 3 sets of the exercises prior, they would do all core, balance, and reactive, and then they would repeat core, balance, and reactive. Or you can do all core, all balance, all reactive, or plyo, depending on how you want to term it. But once they've completed that, then when we go into the resistance exercises, we want to think about what's ideal for phase 1. So again, you want to think about your rep range. Our rep ranges are anywhere from 12 to 20 repetitions. Our tempo is very slow, so we're actually focusing on the eccentric, so decelerating. So our tempo count or our cadence would be anywhere from right around a 4-2-1. And again, you're just counting down these to give yourself kind of an idea on tempo, because you don't always want to be like down 4-2, 4, 3, 2, 1, hold 1, 2, so don't count that out loud. Maybe the first time, so the client starts to understand, how fast you want them to move. But then once you kind of set a really good tempo, then you continuously work with them to slow things down or speed them up. Our rest for this particular individual is 0. And the reason we did 0 was because we want him to minimize his rest, because we want him to burn more calories. And he is, pretty active. And so again, because he came in with a background of activity and he wants to start to get himself ready for a soccer league in 6 months, we want to start kind of building that, that kind of movement throughout. So we are going to do what we're calling a vertical load. So he will do one exercise, then go to another, then another, then another, and then repeat. So the first exercise Marty and I chose that we thought would be beneficial for this client was a cable squat to row. And Marty, do you want to tell him why we chose that?
Absolutely. So almost exactly, with the image I just drew is that triple flexion, triple extension. When you have the weight out in front of you, it's an easy way for someone to learn how to squat properly after we clean them up. Now we want to help them learn how to squat properly. So it helps let them sit back a little bit because the weight's out in front of them. It helps force the core to be activated, and then it helps get them into that extension with retraction position or ideal posture at the top. So Wendy and I use this. That's a go-to for us all the time. Have to be able to do a squat to row.
Mm-hmm. And then again, after we do that, we want to think about still challenging their core, still working on, something that would be beneficial and somewhat unstable to this individual based on his overhead squat. We actually chose to do a floor push-up. And Marty, you want to tell them why we did that?
Sure. So to me, the push-up is nothing more than a moving plank. So we're going to talk about client's choice here in a minute. But, males especially, they're going to want to do some level of chest. We're going to have gone through all of the proper warm-up and, techniques to get them ready for that. But now I'm sneaking in a lot more core stabilization because they're not going to be doing this push-up unless they can keep their body in that perfectly positioned plank. And that push-up is just a transition from low plank to a high plank. So it's phenomenal to give them what they think they want, but really sneak in a lot more of that core integration.
Mm-hmm. And with this being, a dentist as well, I mean, think about how he's got a forward head throughout the day because of his positioning. So it really does help when you're having to teach him how to retract his chin and squeezing his glutes the entire time, and making sure that his heels don't touch. And that's something that a lot of times we forget when we're looking at the 5 kinetic chain checkpoints. We're so involved in what's happening at the upper body. Be sure to check to make sure the heels don't touch. Because in order to get a really good glute squeeze, a lot of times people will put their feet together and they're actually activating more of the posterior fibers of their adductor magnus versus their glutes, which is primarily what we want them to activate, which is, again, is the glutes and drawing in. So after they've done their push-up, then another exercise that Marty and I really liked is something as simple as a single leg cobra. And I say simple, it's not necessarily simple for the client, but.
There's a distinct difference between simple and easy. I just want everyone to be clear on that.
So Marty, you want to tell them why we chose that?
Yeah, so especially for me, after I do some type of pushing, I want to get back into a pulling or retraction based exercise. So that even gets into how we sequence these. But that Cobra, one single leg again is going to get all those little muscles in the foot and ankle and, the whole. So we're sneaking in more of that, a lot of glute activation. And now they're going to even, again, have to activate their core a lot. But the simple motion of shoulder retraction, depression is going to be very important for Alex because he's going to be in that position of that forward head, elevated shoulders, the complete opposite of a Cobra all day long when he's working on his patient. So this is so important for him. All of us need it, but especially for what he's doing for a living. So that's why we put it in there and right after the push-up as well. So we get back into getting our neutral position.
Okay, so when you're performing this, the single leg Cobra, and all of your other single leg exercises, what's your preference, or what do you recommend for the trainers? Do you recommend switching the stance leg halfway through the set, or maintaining the stance leg for the duration of one set? What do you do?
I can answer because I was talking about in a second. Sorry, Wendy. It depends on how the client can control it. So if they can't control it, I might have them do, that tiptoe in the back leg because it's still less than both feet on the ground. I would like them to do the one full set on the leg because I want that time under tension. Generally, if I have 3 sets, what I'll do is I might split the third set, or I might put them on the leg that may need more work because I'm not afraid to work one side of the body more necessarily if that's what what they're showing me. So I do try to get them the complete set on one leg if possible. Unless their form and technique's not good, that's an assessment showing me I need to regress to maybe a tiptoe type of stance.
Okay, great. Wendy, what do you, since I think we lost Marty's camera, so tell us about your preferences of how you manage single leg exercises.
Well, that's exactly what I do as well. So I usually perform, and in this case, we were talking about doing 12 repetitions. I would do all 12 repetitions first set, and then again, I would switch legs on the second set. And then to Marty's point, if I decided to do a third one, I would look at the overhead squat and I would either do a split, or if I did notice that he struggled more, sometimes working on, for instance, he had a left knee cave in on two legs, I may go back to just the left leg and work that alone as well. So it kind of depends, but again, we're looking at what can he, how can he hold his 5 kinetic chain checkpoints, and as long as there's nothing compromised, then we can kind of play it by ear and do it. You can do it any way you want.
Okay, thank you.
And then one of the last exercises, and again, we say last because think about timing, and this is the first time. So we have decided that we were going to do 2 sets of everything, and 2 sets of 12 at a 4-2-1 tempo. You want to think about the time it takes to go through transitions, teaching, and everything. So the last exercise we wanted to do was again more of a combo to get more exercises in, but we both liked the step up to Scaption. And Marty, do you want to tell them why we like that?
Yeah. So a step up is the next logical progression from a 2-legged exercise like a squat. It's a transition before we get to lunges. So that step up, again, we can control the depth from 2 inches, 4 inches, 6 inches. It's what they can control. We're not going to go over 90 degrees. But now we're starting to teach them that triple flexion to triple extension on one leg. So more time under tension. And then the Scaption, again, is the safest position for the shoulders to be in. We know the lats are tight, so we're not going to want to do an overhead press yet at this point. So Scaption is great to activate the rotator cuff, adds in a little complexity to the step up, so there's a little more balance and coordination. And obviously the weight that they're holding adds a little more work on the leg as well.
And then again, we would vertical load that. So as soon as we got done with the step up to Scaption, we would repeat and go right back into the cable squat to row. And then Marty, do you want to kind of take us home on the cool down?
Yes. So the cool down in all phases of training is going to be the same as our warm up in this phase, which is the SMR and static, generally speaking. So we would go right back through, look at, what muscles tend to be overactive in general. What muscles did we attack? We did whole body, so we'd have to look at that. And then what muscles did we really need to address for Alex in the warm-up? So at this point, I'd recommend completing the exact same thing we did in the warm-up, the calf complex, the adductor complex, the lats. If you wanted to throw the TFL in there, because that's one hip flexor that you can get with the foam roller, you could do that. And then same thing with the static stretching. I would hit the exact same muscles that we foam rolled, calf complex, adductor complex, the lats, and hip flexors.
And so if you want to look at a filled out template besides Marty's board too, we can go ahead and, we can provide you with that. And you can be creative, but again, you want to think about the purpose of it. But if we went to the side, you can see the final, this is something that you're welcome to print.
Okay, so we have this nice new space down there, that nice new block in our template called Client's Choice. What do we want to do? What do we do in that section? It's right in the title. But what would you have your clients do in this phase?
For example, client's choices, you can always ask them, is there a certain area that you really like to work? And, again, it depends on the client. Some females want to do more abs, and some males want to do the guns. And so at this point, you kind of find out, like in the subjective part of your assessment, hey, is there exercises that you really enjoy? And then maybe at that point you can add them in here. So for example, with Alex really likes to work his bis and tris. So we could do a set of biceps, and then the second set we could do a set of triceps, or we could do 2 and 2 depending on our timing. But it really is the client's choice. It's just if they want to do something that is not, they're not ready for and it's not safe, then just say, okay, that's great, and we can move that on to future workouts. But right now, is there anything else that you want to work on? So you have to really be strategic on how you ask, and make sure too that you let them know that you're not going to forget to do it in the future if it's something that they're not ready for right now.
And then to add, what I do is I give them the choice, but in the back of my mind, I'm still going to dictate what happens, meaning that if they're in phase 1 and they want to do bicep triceps, okay, let's do single leg bicep curls, slower time under tension. You're going to do your reps on your right leg, the first set, left leg, the second set. They got their biceps in, but they're still following the phase. And then if they wanted triceps, They might do a stability ball skull crusher. So that way they have to have that time under tension, keeping neutral spine, keeping their glutes activated instead of just putting them on a bench or a tricep rope. So I'll still get creative, but giving them the choice. So that way I still know that my template is going to be followed.
Okay, outstanding. Now I'm looking at the template that you all have filled out, and there's a lot. This is a pretty tough session, but we have trained in maybe the past few years and a little bit now, where there's this perception of needing to be beat down in the training. Someone would look at this as you've written it down and say, well, that doesn't look hard enough for me. How do you, and this is for both of you, we'll start with you, Wendy. How do you, as a coach, how do you manage something like that?
Well, again, I don't think anyone should judge it till they do it. And what I mean by that is, you can look at any workout that you see in the textbook or anything that you see online. But if you really do the time under tension, as Marty said, and you follow the acute variables, this is very, very challenging. And this is something that you could do for a professional athlete that came in if they had some assessment results like you saw with Alex, because their body, we're really targeting areas and muscles that are underactive, and we know that they are based on the assessment results. So just because it may look easy, it's really, really challenging for someone, especially when you try to think about doing planks for reps or a 4-2-1 count push-up, or truly doing a step up to Scaption, and it could be a step up to balance to Scaption. So it probably should have balance in there. But it's very challenging when you're slowing everything down and trying to get the right muscles higher.
It's like depositing money in the bank. You don't call on your first deposit. You have to wait for the dividends to training is very much similar to that. So Marty, what are your thoughts? How do you talk client, or maybe even one through this not being as easy as it may appear on paper?
Everything to however Wendy said. So then just to add to that is, you didn't hire me to destroy you. You hired me to build you up, and a specific approach to it. I completely understand where maybe in the past you had different workouts or outcomes, but that's why you're working with me now, because I have the best science behind, with experience, and a path to get you where you want to be. We're not trying to make it harder. We're trying to make it systematic and obtainable. And the research shows us overtraining is overtraining. But this, again, with that time under tension, there's a lot of volume there. Let's just give it a whirl and watch what happens in a couple weeks. And inevitably, everyone's like, I feel so much better and I'm getting great results.
Yep.
Okay. We have a question from Sergio. And thank you for listening today, viewing today, Sergio. And he wants to know how long, so you'll have to do some math now. I apologize, but how long would you say this workout is?
This can get done in an hour, without doubt.
Okay.
And if we needed to change it to 45 minutes after the first session, we might have only done one set, because it's like we're learning how to communicate to this individual. They're learning how we teach and what certain terms mean. So we could have spent a little more time and only done one set explaining that hey, next time the process. And they have 45 minutes or so. This can be assigned to them before you guys start together. And then this part could easily be 45 minutes.
Yeah, and I think that's a good point. 45 minutes to an hour is about how long. I remember Arnold saying in an interview many years ago, unless you have access to a pharmacy, 45 minutes to an hour is plenty of time to get a very decent training session in, and this one just appears to be designed right within that time limit.
Yep.
So does anyone else out there listening to us have questions about why they picked, why Wendy and Marty picked the warm-up they did, why they chose the resistance exercises, the rationale behind building this template at all? Please, we want to leave today with all of your questions answered. And as we're waiting for these questions to come in, Wendy, What are your takeaways from today? And I know for a fact that you actually documented how they can contact you after this webinar, but can you tell us anyway?
Certainly. I mean, again, the big takeaway is to look at the assessment, be very specific in the information that you gather to make sure that the assessments that you do make sense to, what the client's goals are and their outcomes, but then also the level of where they're starting. I think, with the exercises that we chose, we are following the phase 1 kind of quote protocol to build the specific adaptation that we're looking for. So we're working on stabilization, endurance, and have fun with your exercise selections. Try it in different planes of motion, but this is just a simple one and I say simple, the exercises are challenging, but it's just an easy exercise template to follow, and then you can kind of plug and play your own exercises that seem safe for your client as well. And then you can see my contact information. I forgot to put my Instagram on there, but my Instagram, is Wendy Bat or Wendy.Batts13 is my Instagram. And then Wendy Batts or Wendy.Batts at NASM.org.
Okay. And Marty, what are your takeaways?
Don't overcomplicate it. Let the time under tension, the work to rest ratios do the work for you or your client. And when you look at in addition, when you're using these muscles for the first time because you've corrected some imbalances and you're moving properly, that adds a whole nother layer of intensity as well, because you're teaching muscles to fire that aren't used to contributing during exercise, more than likely, especially if they exercised and they weren't moving well. So everything is there to make it intense enough appropriately for that phase of training. So don't overcomplicate it. Keep it simple. Follow the acute variables. Follow the form and technique. Everything will take care of itself for you. And then my images are right there. So Marty.Miller at NASM and Miller.Marty72 for Instagram.
Okay. And that is a wrap today. I want to thank everyone who did the webinar today. I hope that you learned something. I hope that this demystifies program design a little bit. I want to thank Wendy and Marty and Greg there in the background. Thanks everybody for hopping on and joining us today, and have a great afternoon.
Thanks everybody.